Good morning. My name's Amanda Laskuski. I am the president of the Pennsylvania Coalition of Nurse Practitioners, and we are an organization that represents Pennsylvania's 18,000 plus nurse practitioners dedicated to the care of patients across Pennsylvania. I am honored to be joined today by a smattering of nurse practitioners from across the Commonwealth, as well as our champion legislators, Senator Bartolotta, Senator Boscala, Representative Khan, Representative Genst, and Representative Cabell. Additionally, you will hear from individuals from the Hospital Association of Pennsylvania, the Convenient Care Association, Pennsylvania Association of Community Health Centers, the Health County Commissioner, a valued patient, and our own President-elect Janice Miller. Nurse practitioners are a proven solution to the healthcare crisis in Pennsylvania. With physicians retiring and less physicians choosing to go into primary care, the patients of Pennsylvania are struggling to find adequate care for their needs. Nurse practitioners are not physicians, nor do we want to be. We are expertly trained advanced practice nurses who provide safe, quality care to our patients, and we are ready and able to serve the patients of Pennsylvania. We do not need to be recruited. We reside and practice right here throughout the Commonwealth. But our practice is restricted by an archaic rule requiring that each nurse practitioner have an agreement with 2 physicians in order to practice. This agreement, called a collaborative agreement, is required for nurse practitioners to prescribe medications and to treat patients. The agreement might lead one to believe that the physicians are actively involved in each patient care. Reality is quite different. In most cases, the nurse practitioner has never met their collaborating physician, and the physician has never met the patients. It is simply a financial agreement in which the physician is paid a yearly fee for a signature on a piece of paper filed with the State Board of Nursing. Senate Bill 1825 and Senate Bill 25 and House Bill 1825 would lift the requirement of an agreement between nurse practitioner and physician without diminishing our collaboration. It's in our DNA. No more would a primary care physician need a contract to collaborate with a specialist than a nurse practitioner needs a contract to collaborate with a physician. 27 states, the District of Columbia, and the Veterans Association have eliminated the need for collaborative agreements and allowed nurse practitioners to practice fully. Not one state nor the Veterans Association has reversed this decision. Empowering nurse practitioners not only addresses the healthcare gap, but also promotes economic efficiency. It reduces bureaucratic barriers, leading to cost savings for both healthcare providers and patients. Additionally, it encourages entrepreneurial opportunities for nurse practitioners, contributing to local economies rather than losing these forward-thinking practitioners to the surrounding states of Maryland, Delaware, and New York, very close by, which offer full practice authority. This approach is cost-free and may actually increase revenue for Pennsylvania through licensing fees, while increasing the number of care providers to patients. Adopting these bills is a step forward to a more efficient, patient-centered healthcare system in the Commonwealth. It reflects individual responsibility and free market solutions to societal challenges without adding cost. It is my honor now to introduce Senator Lisa Boscala.
Thank you. Hi, everyone. Can this be our last rally? How many years have we been doing this? 12. I know. We want this to be the last one. I have no idea why we can't get this bill passed out of committee on the Senate floor into the House and get the governor to sign it. I know the governor would sign it if we would send it over to him. Nurse practitioners are critical to our healthcare system, and expanding your role makes sense for every resident in Pennsylvania, and I am proud to support you. Just the other day, I was with my OBGYN, who I've been with for about 30 years. He's retiring, and he said to me, Lisa, you no longer have to get a gynecological exam anymore because I'm 62, not at risk.
You look great.
Yeah, thanks. Didn't want to put that out there, but the why I'm saying this is because he is now sending me to his nurse practitioner. Every year I will see her. And I told him about this bill, right? So I said to him, we have a bill that will expand, nurse practitioners. They don't have a collaborative agreement. He goes, what is that? I never see my nurse practitioner. He never, ever does, and he allows her to practice without him around. It happens all the time. This is just about money, and it's not about patient care anymore. So let's get this done. I also want to say that we aren't breaking any records here. 27 other states already provide full practice authority to nurse practitioners. I want us to be number 28. It's not that hard. All right. So that's all I wanted to say. I'm going to be here with you as Senator Bartolotta is. She's your champion, man, and we're going to work so hard to get this done. Thank you, everyone.
We now will have Senator Camera Bartolotta.
Okay. Thank you. Man, what a hard act to follow. Holy cow. How much coffee do you have, sweetheart? Love you. She's my spirit animal. She's awesome. And so are you. And you know what? I love you guys, I really do, but let's stop the reunion every freaking year. Can we try that? That'd be awesome. Again, every single time we come before you to talk about this legislation, we add one more state to the list. Why can't it be Pennsylvania? Why not? We wanted to be number 25 for SB 25. And we're at 27 every single year. It's another thing. To heck with this whole, we need a pilot program. Do you know what a pilot program is? 27 states and DC and every VA in America. And another pilot program? You know this little thing, I don't know, maybe some of you heard of it, called COVID? Do you remember that? Yes. Yep. Our nurse practitioners were the boots on the ground. They were the army. They were the front lines for all of these people. And we didn't have a major disaster, dogs and cats falling from the sky, right? Enough already, enough. We have got a terrifying and embarrassing problem in America. Do you realize that we are worse than some third world countries when it comes to maternal mortality? Yes. That's absurd. This is America. How can that be? And we have wonderful, highly educated, incredibly capable, these nurse practitioners, they have master's degrees, some's doctorates. They work for years and years and years with families they grew up with. They understand the needs of their communities and how to serve those needs in an efficient, effective, and economical way. Today, you don't have to wait for years for some, a new program to be established and take root of. No, they're here, and guess what? They want to stay here. They want to stay in Pennsylvania, in their neighborhoods, and do what they do best, and that is to provide excellent health care to their friends and their neighbors, and we're losing them. Pennsylvania does a great job of chasing good people out of Pennsylvania. Let's not be number one with that anymore. We need our nurses to stay here, provide excellent care. We have got a massive need now, more than ever before, for mental health care because of the COVID lockdowns, because of isolation, because of all of these individuals who are terrified to go to the hospital or the doctor's office. How about doctors who are no longer in practice anymore? I have had people tell me that they couldn't even be a nurse practitioner in their hometown anymore because there wasn't a doctor left to have a collaborative agreement. This is insane. I mean, it is far past time that we do the right thing when it comes to good health care. It is way past time. We have the qualified, dedicated, wonderful folks right here, right now, ready to go. Let's open the door. Let's open the floodgates of excellent health care in Pennsylvania, keep these people here, and do what our job is, and that's to protect the health and welfare of our constituents. Let's put our money where our mouth is and get this bill passed. Thank you so much, everybody.
It is now my honor to introduce Representative Nancy Genst.
Sorry, I'm a little short here. Good afternoon, everyone, and thank you for being here today. Full practice authority is a proven solution for many of the healthcare challenges facing us today. This is already occurring in 27 other states nationwide, and over 100 studies have been done to have shown the nurse practitioners' patient health outcomes are as good or even better than other providers, ensuring patient safety. Under this legislation, nurse practitioners would be able to serve those in rural and urban areas and increase patient access to those who do not have health care readily available or even near to where they live. In the state of Pennsylvania, we are losing nurse practitioners throughout the Commonwealth to other states who have already adopted full practice authority. We desperately need to retain these invaluable healthcare workers. Also, many of our MPs would love to open their own practices, but with the costly collaborative agreements currently required, they do not have the ability to do so. If we pass this legislation, those agreements go away. And now we would have the viable answer to the shortage of primary care providers across the state. There are two very important things to remember here. Pennsylvanians overwhelmingly support this, and this comes at no cost to our taxpayers. Thank you.
And now I hold the mic over to Representative Khan.
Okay, thank you. All right. How are my nurse practitioners? You all look beautiful. I love you. My name is Tara Khan. I'm a representative from Northwest Pennsylvania, Northwest Philadelphia, East Falls, Manayunk, Roxborough, and Chestnut Hill. And by the way, I'm also a nurse practitioner. I am proud to be the first nurse practitioner ever elected to the legislature. And I want to can we give another hand for our champion in the House, Representative Nancy Genst, who's doing the work. Representative Genst has been a champion for this bill because we know it makes sense. This is not a heavy lift. And I can tell you, this is not about us as nurse practitioners. This is about patients. This is about access to care. This is an issue that is not just important in areas of Pennsylvania like Philadelphia, but also in rural areas where finding a primary care provider is extremely difficult. And 27 other states and the District of Columbia, where I worked, by the way, as a nurse practitioner, have been able to get this done. This is not also a Democratic issue. I am a Democrat. President Obama did increase full practice authority for the VA, but this is also a conservative issue. Our most conservative groups, yeah, let's give it up. Let's give it up. That's right. Let's give it up. Because we know that this is bad for our economy. The fact that we are constricting artificially where practitioners can practice, where patients can get access to health care, having to wait weeks, sometimes months, to get an order signed by a physician when a nurse practitioner is more than qualified to do that work. And I know this not only because I'm a nurse practitioner, but because I spent a year at AARP as a fellow, and I studied full practice authority. And AARP is like many institutions and many entities that support full practice authority because it's based in research. It makes sense. There are volumes of evidence. Do we need a pilot to find evidence that full practice authority makes sense? Do we need further delay? No. Then what are we waiting for? Are we going to get this bill passed? Yes. All right. I'm supportive. Representative Genst is supportive. Representative Cabell, who couldn't be here today, he is supportive. And we have support, bipartisan support in the Senate. So let's get this done. So what I need you all to do is go to your legislators today and let them know. Tell your stories. Tell them why it's important. Tell them the stories of the patients that come to you that have access problems and that only were able to get access because of you. Tell them about your patients that are struggling to pay for health care, that are having problems paying for their prescriptions, but because of you have access to that care. And tell them your stories of why we need this passed, not tomorrow, not after we do a 6-year pilot study, but today. If you're watching at home, call your representative, call your senator, and let them know why this is important. This is an access issue. This is an issue that is important to our Commonwealth. I urge you support full practice authority for nurse practitioners. Thank you.
Next, I would like to bring up Nicole Stallings from the Hospital Association of Pennsylvania.
Yeah.
Thank you. Good morning. On behalf of our 235 member hospitals and health systems, I want to thank our sponsors for clearly recognizing the need for this bill, for the thoughtful approach that is being moved forward. It is reasonable, it is responsible, and Pennsylvania's communities are ready. They are ready because they are feeling the effects every day of the workforce shortages across the Commonwealth. Here in the Commonwealth, we have some of the most severe shortages in the nation, and this will only worsen without action as our Commonwealth ages. Hospitals, FQHCs, and other settings across the continuum are doing what they can to recruit and to grow the next generation of our healthcare workforce, but they need help. We need a comprehensive and sustained effort to ensure Pennsylvanians have access to the care they need when they need it. And this includes ensuring health professionals are able to practice at the top of their license. This means they should be able to fully utilize their training and their expertise, and this is especially true in rural communities where advanced practice professionals play a critical role in ensuring access to safe and high-quality care. We've all seen the headlines, headline after headline, about the urgent need to support access to care across the Commonwealth and in our rural communities. This is a tool in the toolbox. We are proud to support it. Thank you.
Thank you very much, Nicole. And next, we are going to hear a patient's perspective. Ms. Betty Gray.
Yes, go Betty.
You're the woman, Betty.
Good morning. How are you? Good morning. I'm happy to be in the Rotunda again. This is my second time here of explaining why we need to pass Senate Bill 25 and House Bill 1825. So let me tell you who I am. My name is Betty Gray. I'm a patient. My PCP, my primary care provider, are 2 nurse practitioners. They're up in that audience, Michelle Hall and Dallas Riley. I am one of 12 million residents of Pennsylvania who are also patients on any given day. I believe I can accurately speak on their behalf to say that death, truly death, should not be the only option due to an access to care issue. But across the state at this very moment, guess what's happening? Someone is being told they can't get an appointment for 3 to 6 months or longer. And many of these are for life-saving services. There's just not enough providers, plain and simple. If you live in the rural area where I live, Berwick, Columbia County, we have no public transportation. For many issues, it's at least a 25-mile ride to get vital care. In the summer of 2022, Mrs. Priyam Sharma of Fayette Holdings closed the primary care clinics, and guess what happened? She unleashed 10,000 patients into the next door health system, Geisinger. And guess what? They can't keep up. They're overwhelmed as it is. So Dallas Riley, Michelle Hall, and Verona Roberts stood up to the plate, and within 4 weeks, Michelle and Dallas opened their own primary care clinic. They could have gone anywhere and gotten a job, but you know what they did? They chose to stay and take care of folks like me. So we've had a physician shortage in the Commonwealth for years. This is a song that never ends, but it's time to stop with the solution of Senate Bill 25 and House Bill 1825. Can I get an applause for that? If my calculations are right, this legislative session ends in December. It's already going to be May 1st. What are we doing, people? I mean, really, what are we doing?
That's right.
So the time is now, not tomorrow, not next week. Heaven forbid we have to do this next year. 27 states and the District of Columbia are ahead of the game with us. They're taking nurse practitioners from us and using it to the patient's benefits there. So I'm going to be really bold today. I'm going to invite every legislator to the community of Berwick and the surrounding area. I am going to invite Governor Josh Shapiro to come and sit down with the people of my community after they have lost not only our only hospital, but we've lost primary care. We're not getting it back. There's no white coat cavalry coming in to save our lives. Not today, not tomorrow. It's only because of the people behind me, the nurse practitioners, that are going to be the savior of my community. So I'm going to hold up my phone right here. Here's my phone number, legislators. Here's my phone number, Governor Shapiro. It's time. I have written letter after letter after letter. I'm done writing. Now comes the time to start the conversation. It's overdue time. So here's my phone number. Take it down. 570-204-3930. And before I leave the podium, I really have to ask these two young ladies, our next generation, to come up here and join me, because this is what we're fighting for. Come on up.
That's right.
These young ladies are who we are fighting for. Don't anybody forget that ever. Thank you very much.
That's right.
Betty is the woman. Next, we are privileged to have Mike Clark from the Convenient Care Association join us. Thanks, Mike.
Let's go. Let's go. Come on, that was amazing. I am so inspired today by all of the heroic action, from legislative action to advocacy action to our heroes behind us, the nurse practitioners themselves. Let's give them a hand, please. Amazing work. On behalf of the Convenient Care Association, I would like to voice my support for this legislation, which will provide full practice authority in the state of Pennsylvania. And I also want to especially thank Representative Genst, Representative Kahn, Representative Cabell, Senator Bartolotta, and Senator Boscala for championing this legislation that puts patients first. Thank you. Imagine a future where every individual in Pennsylvania can swiftly, affordably, and reliably access quality, safe health care. Nurse practitioners are a proven solution to making this a reality for Pennsylvania patients, and full practice authority legislation is a proven solution to making this happen now. Not tomorrow, not 3 months from now, now. This is only my second time doing this, but I hope that I don't have to be here a third time either. The Convenient Care Association represents the retail health industry in North America, which is comprised of convenient care clinics such as CVS Minute Clinic and Kroger's The Little Clinic. Today there are 3,800 such clinics in the United States, and CCA member clinics represent approximately 97% of that industry. Our members represent the first mile of healthcare, serving as an entry point and first interaction for patients, and our nurse practitioners not only help patients at the beginning of their journey, but also serve as ongoing partners in health promotion. Nurse practitioners serve as a frontline solution to an ongoing access crisis. Nurse practitioners carry out life-saving diagnoses, treatment of chronic conditions, and preventative interventions at convenient care clinics on a daily basis. Our members represent the largest corporations in the country, and I've heard this before, but this bill is not only health promoting, you've heard this before, it's also economy promoting. It's also economy promoting for the state of Pennsylvania. However, these archaic restrictions and red tape prevent investment from industries like ours, further investment in the state of Pennsylvania. We currently represent over 80 clinics in the state. That number could easily double if legislation like this passes that removes unnecessary barriers, unnecessary restrictions. We're also now working with mobile health clinics in the Community Care Association, which are addressing rural areas. There's about 40 in the state, mobile health clinics that would also love to see this legislation passed. I also serve as a policy fellow in the IDD and autism sector, and I just want to bring up how important nurse practitioners are for this field and mental health care in general. Pennsylvania has a massive mental health shortage. Pennsylvania has 151 mental health shortage areas, and the number of psychiatrists treating Medicare patients, it decreased by 6%, where the MPs treating Medicare patients, psych MPs treating Medicare patients, increased by 162%. You kind of see the direction that those things are going in. So we have convenient care, we have mental health care. NPs can address so many access and patient issues in the state of Pennsylvania. I cannot believe that this legislation has still not been passed. It doesn't cost anything. It's a stroke of a pen. Let's make this happen. Let's make this happen right now. Let's make this happen tomorrow. And I just want you one more time, and you can imagine our future here. We have my fellow young citizens, where they have a future where every individual, when they grow up, can access swift, affordable, and reliable health care. And a proven solution to do that is nurse practitioners. A proven solution to do that is full practice authority. Let's get this done. Let's get this done right now. Thank you.
Thank you, Mike. And now we are going to hear from Eric Keel with the Rural Health Perspective. Thank you.
Wow, how do I follow that, Mike? That's great. I can't emphasize enough how important nurse practitioners are to the community health centers, but more importantly, and as we mentioned earlier, it's about patients first.
That's right.
Patients are the most important part of this equation. Patients are the ones that can't access health care. It's not just primary care, it's behavioral health services, and nurse practitioners are filling that gap day in and day out across the state. We have 375 locations across Pennsylvania. We cannot find enough physicians to care for those folks. 80% of the million people we care for every day are on Medicaid or uninsured. Nurse practitioners are the backbone of what we do day in and day out. We employ more than 300 nurse practitioners across Pennsylvania. They care for 750,000 patients every year. That's why Senate Bill 25 and House Bill 1825 are so incredibly important to the future of healthcare. We heard about Berwick's hospital leaving. We heard about the challenges other healthcare providers are having. To fill those gaps, FQHCs are there doing it every day, filling the gaps across Pennsylvania, partnering with our nurse practitioners. We need this legislation to be able to continue to care for Pennsylvanians. We support this legislation.
Thank you.
Thank you. And next, we're going to hear from Elk County Commissioner Matthew Quisenberry. Let's give it up. Woo! Woo, woo, woo.
Morning. Thank you for having me. It's an honor to be here. I shouldn't be here. Which doesn't mean I don't want to be here, but I don't have a dog in this fight. I was not looking for a cause to champion. As a county commissioner in my third term, healthcare issues were seldom, if ever, a direct concern of local government. That all changed this February when Penn Highlands Healthcare dealt a blow to our community by announcing the closure of labor and delivery services at Penn Highlands Elk Campus. No longer will newborns enter this world within our county's borders. Instead, expectant mothers must endure a 45-minute journey to Du Bois, and that's in good weather during the day. Suddenly, fighting to provide those living in Elk County with the best possible health care became a critical priority. What perplexes me is that this move purportedly was not driven by financial motives. Although the exact reasons for this decision are difficult to pin down, there were claims it had something to do with physician burnout and the inability to attract new talent. But solutions are within reach. We need to heed the wisdom found in recent publications exploring innovative models that leverage the expertise of nurse midwives and women's health nurse practitioners. In neighboring McKean County, nurse practitioners staff entire emergency rooms, demonstrating the feasibility and the efficacy of such approaches. These are no longer hypothetical situations in our rural region, but the reality of how we must pursue our healthcare goals. As I mentioned, I'm not here today to represent a constituency. I'm here today to represent all constituencies. Make no mistake, this issue transcends more than just quality of life concerns. Elk County's economy, heavily reliant on manufacturing, faces a precarious future if we allow healthcare services to erode. A decline in healthcare accessibility jeopardizes our ability to maintain a robust workforce, sending shockwaves through local, national, and even global markets. We cannot afford to procrastinate. The time for action is now. We must rally behind legislation that safeguards our community health and economic vitality. This innovative approach to cover rural areas and increase patient access simply cannot wait another day. Tomorrow may be too late. Now, given the theme of what I've heard today, and don't take this the wrong way, I'll visit any one of you anytime again. But I got enough to do in Elk County. I don't want to be here a year from now. Okay? Let's get this done. Thank you.
Thank you. Thank you, and thanks everybody for coming. Woo! I'm so proud to be part of this organization of wonderful, wonderful people, and so many people who support us. And today you've heard from our president, Amanda Laskoski. You've heard from very, very insightful legislators. You have, and the senators who have other commitments. We have also heard from major stakeholders who are supportive and large organizations, and we thank you very much, and we will not let you down. And we've heard from a county commissioner who had the rug pulled from under his feet, and we are standing by you, and we want to help you as well. So thank you for coming today. And what I just want to add is to remind legislators there are a lot of nurse practitioners who vote, and we have a lot of family. And let me just tell you that in every Gallup poll that is done of a national survey since the year 2002, every single year, the profession that is the most trusted across the nation is nurses. We didn't practice that. They know. So legislators, your big constituents will thank you, and we thank you as well. Have a great day.
Thank you.
Thank you.